But yeah, so just as a refresher, Missouri Appleseed, we are a very teeny tiny little nonprofit. We serve the state, but we're located out of St. Louis at St. Louis University School of Law. We believe all Missouri families deserve the opportunity to thrive. We work to improve the systems and the policies at the intersection of public health, criminal justice, and child welfare.
I know it's a big thing. We don't have help. We're having too many mental health issues. I would ask each one of you to support Missouri Appleseed and support us to get these serious situations resolved, or at least get our foot in the door to start solving some of the problems. I feel honored to be able to work with her and her staff. So thank you for coming.
Well, like Jeannie said, thank you so much to all of you for being here. We have representation from over 30 Missouri counties, and we've got a few more on a Zoom webinar who couldn't make it today. So really thrilled that we're all here to work together and talk about some of the major problems we're facing, but some of the solutions we can go after.
We know all of you want to provide better services for your jail residents, and addressing mental health services will improve quality of life. So the way that we designed the survey is that we asked jails across the state to tell us about their mental health needs of people in their jails and challenges they face holding individuals determined incompetent to stand trial.
My name is Jason Klaus, Sheriff of Perry County. Much like Sheriff Dickerson, I was born and raised in Perry County. I started my career in 1996. I was appointed sheriff in 2022, and so I'm in my first term, almost 3 years though in this. In 2018, I was appointed the Missouri Crisis Intervention Team Coordinator, and through that role I was able to work with a lot of the individuals in this room, really focusing on mental health and training in law enforcement, but that has evolved so much over the years, and now really taking a deeper dive into those individuals incarcerated, having those same concerns. So we have a lot of work to do, but I know that by all of you investing the time today, we'll get some great conversation out of today's meeting.
So the Medicaid enrollment process is a proven strategy to improve our public health and our public safety. People leaving the jail with health insurance are more likely to receive treatment for chronic illnesses and behavioral health issues, which can reduce the risk of returning to jail. It also provides a fiscal incentive for local governments as it shifts the cost of post-release health care from local emergency rooms and indigent care programs to our federal and state Medicaid programs. Ultimately, it's a proactive and humane approach that helps individuals and benefits the entire community.
I don't want bad things to happen to the people on that list. Don't want bad things to happen to people that are in the community. So we do know that something different has to happen. And so I feel really good about the fact that we have a Chief Justice who's saying, let's get people in the room. Let's figure this out.
Because if they're not getting their basic needs met, they're not going to meet the needs of their bodies or their minds, or go to court or go to their probation officer. So it's really critical that we're really working to implement holistic care and working to integrate a lot of our systems together. And that's what I'm going to talk about and really encourage you, and hopefully this is what you take with you from today, is how to maximize and leverage the resources that we already have. We can easily recognize those challenges and those gaps that are out there. We know that. We know what we need. We know what we're missing.
And then we also want to hear your stories. So if you just go down the hall right there, talk about the problems that you're facing, talk about some of the solutions that you found. Hearing direct quotes from the people on the ground is what actually moves legislators, policymakers, and helps us change things in the budget to make sure you can get some more of the resources that you desperately need.
My name is Richard Russian. I'm the jail administrator from Cape Girardeau County Sheriff's Office. Back in 1987, I started at Cape Girardeau County in the jail. I learned a lot about mental health and illnesses, and I learned there are people too, and through sometimes medications, guidance, constant care, they can have normal lives. If you think about it, mental health patients take twice the capacity, because I really can't put them in a cell with somebody else. And they take 10 times to 20 times more care. And we need specialized care. I have 18, 20-year-olds dealing with these people, and they don't know what life's about yet. That's the challenge I see, and that's the challenge I just brought up in there to the people. Whether you're from a hospital, whether you're from a mental health facility. We've got to partner together to get these people help. Well, can I actually talk to the legislatures right now? You guys have the power. We have the information. Let's get together, let's talk, and I look forward to meeting you guys. Our Sheriff, Ruth Ann Dickerson, she's been fighting this fight for a lot longer than I have.
My name is Ruth Ann Dickerson. I'm the Sheriff of Cape Girardeau County. I have lived in my local community all of my life. Once I joined the Sheriff's Office, it was very community orientated. I just dedicated that was going to be my career, and I dedicated my life to it. The inmates in our jail are human beings, and if they weren't in jail, they would have Medicaid. And just because they come to jail, their health issues, their mental health issues do not go away. They deserve the same opportunities in the jail as they would receive outside the jail.
Yes, ma'am. And I don't work in the jails or anything else. I'm a public administrator. So one of the things that we're facing is when people are being discharged from the DOC or jails or whatever, I'm hearing you talk about this 30-day case management pre-discharge or pre-release, and then 30 days following release. What we're getting handed is these individuals are being released from the DOC, but they're being released on a 96-hour hold that's causing our deputies to then transport to a mental health hospital, and then it's left up to society or the community to figure out what happens next. That 30-day follow-up is what we're finding isn't happening. So what should we do to help with that?
Yeah, it's a really good question because it's complicated, right? So this project that we will be doing, so we haven't started this yet. We have to do this work to plan it and then submit that state plan to CMS and get it approved, and then we can start the work. So there's a lot we have to do yet before we'll be able to start this coverage. So I think what I'm hearing from you is that as we work with our vendor and our stakeholders to put these processes into place, that's one important piece we cannot miss, is when there is a 96-hour hold, when they're being released to a hospital setting, when the public administrators are involved. That's going to be a really important piece, is what I'm hearing you say, that we consider coordinating there. So thank you for that.
Well, that wraps up our program for today. Could we have a round of applause again for all of our presenters who came? And thank you to all of you who came and drove from all four corners of the state.
It's an honor to be here, and it's nice to see a lot of people that are actually striving to help make things better in our communities and in our jails.